push.
The road to childbirth can be treacherous.
All right. 1 o'clock on the nose.
Especially for those mothers in the high-risk unit.
The worst case scenario is ruptured uterus. Well, the baby can die right away.
Who come face to face with a whole new set of challenges.
He's having a little difficulty breathing.
Sickness.
It's me, Renee. I have a baby.
Infection. And a fragile newborn struggled to survive.
He started grunting, and we thought he'd do okay.
And he just got worse and worse.
He got worse
then
pretty
he got
quickly.
intubated.
Push her out.
These are special deliveries. In crisis mode. At University Hospitals of Cleveland, one of the mothers here is about to give birth to the 200th baby born on special delivery.
I'm gonna try your forearm.
Perhaps it'll be Marla Rawson. Every hour, Marla gets her blood pressure checked, and the numbers are hardly reassuring.
All right, this is 154 over 103. That's up there. And you know what? We probably need to lay you back a little bit, get you on your left side.
Just 31 weeks pregnant, Marla has to give birth today. If not, she could go into seizures, and her baby could die.
This patient has a history of chronic hypertension and was doing very well in her pregnancy. Over the last couple of weeks, her pressures were getting higher, but then she began spilling protein in her urine. This was a sign that she developed superimposed preeclampsia. This condition can be very dangerous both to the mother and to the baby.
Approximately 25% of pregnant women with pre-existing hypertension develop superimposed preeclampsia.
You are running a limited race here. The baby will stop growing. The baby's life expectancy may be restricted, and unexpectedly, you can lose a baby.
What do you want me to say, Ma?
There's nothing more to do for Marla or her baby.
The doctor's in here right now. Let me find out what's going on, okay?
The only option is delivery.
Okay.
But the timing couldn't be worse.
Okay, Dad, it's Marla.
On the other side of this very hospital, Marla's 66-year-old father is in the final stages of his battle against colon cancer.
Are they saying he's gonna go? Okay. All right. Okay. All right, bye. In a couple of hours, I'll have a baby, and my dad will not be here, and so, I don't know. But as long as the baby's okay, I'm sure that's all he really cares about, so. I just was so sure he was going to be able to see him, but maybe he will, who knows. Yeah, they said he's going to go pretty soon, like in the next couple of minutes, so.
If you want to go over, we'll see about trying to get you over there.
I know, I'll just get way too upset.
Okay.
Trust me, it's done. It would make her more upset.
Okay. That is an option, so.
Where's the babies? Where's the babies at?
2-year-old Kelsey Lukovic is about to become a big sister.
How many babies are in there? How many babies? 2 babies.
Her mother, Tammy, was admitted early this morning. She is expecting twins, which occur in 1% of all live births.
My membranes broke at 3:30, and it's almost 3:30 in the afternoon, so that's 12 hours, and you're at risk for infection, once your membranes break, so we don't want it to go too long without, getting the babies out.
Well, you're 4 to 5 centimeters dilated. I hate to give up now. You've made a huge change.
Babies are too comfortable up there, I guess. They just don't want to come out.
Once the water breaks, there's no barrier to protect the babies from bacteria that can travel up the birth canal.
If she will be infected, mom will be having a fever and baby will be tachycardic, and it's potential risk for both.
Tachycardia is a dangerous increase in the fetal heart rate. There's a risk to Tammy as well. Her first child, Kelsey, was born by C-section, which makes this 34-year-old mother's uterus weak and extremely vulnerable.
The worst case scenario is rupture of uterus. So the baby can die right away. The mom can bleed to death.
And then there's the position of these twins. Baby B is breech, or feet first.
After the first baby's out, a lot of room is now available for that second baby to turn. If you can't get the baby to turn around, an option is to go ahead and actually grab the feet and deliver that baby breech. She's completely dilated.
Finally. Finally.
The vaginal birth will take place in the OR, because if the baby doesn't turn or gets too stressed by the birth, Tammy will need an emergency C-section.
That first baby's getting down really low. So we'll go ahead, moving back to the OR. And so we'll be ready for anything.
At midnight, Carla Miller and her best friend Cynthia arrive at University of Cleveland Medical Center.
I'm going to have my baby today, or tonight, or no, in the morning actually. So, and I'm a nervous wreck.
The last time Carla gave birth was 22 years ago.
I'm a total mess because I have back pain and I'm scared, and I was too young for the first time to be scared. Now I'm too old and I know everything that can happen. I almost feel sick to my stomach mess.
Your birth date, ma'am?
9/8/66.
At 37,
Yes.
Carla is considered high risk for a number of reasons. First, she has gestational diabetes.
The longer that you go with gestational, the longer that you wait to give birth, more risk of stillborn.
Then, early in her pregnancy, Carla's doctor told her she might have cervical cancer and that she might have to terminate.
So for a week and a half, it was total torture. It was harder on me than finding out that I had gestational diabetes. Ow.
While the biopsy came back negative for cervical cancer, it came back positive for severe dysplasia, a precancerous condition.
During the pregnancy, I found out that the cells have split, so it's getting ready to go into the full cancer.
Once this baby is delivered, Carla will have to undergo a hysterectomy to prevent any cancer from developing and spreading. Then, more bad news.
When we first had the first amnio, they seen a redness in the baby's bowels, and sometimes that could be cystic fibrosis.
Carla and her husband got tested immediately for cystic fibrosis. Carla found out only she was a carrier.
They said that, the most that'll really happen with the baby is she'll be a carrier. If she marries a guy that's a carrier, then they'll probably have a child with cystic fibrosis.
Not long after, there was the numbing pain in her hand.
I couldn't feel my fingertips, they were all numb, and I was having shooting pain go down through my hands at night into my elbow. They said that that was carpal tunnel that's caused by the pregnancy, so hopefully that'll go away 3 months after I deliver. Like the book that has what to expect when you're expecting, I've had everything that's in that book. Can't give me any more bad news, I'm ready, but I'm not ready. I'm just not ready.
So you're for induction tonight, so I'll put a Cervidilin in your vagina to help the cervix dilate and kind of getting more soft.
I was thinking more like 7 o'clock in the morning I'd be ready to be having this kid, but that's not going to happen.
We'll see.
But with this pregnancy, nothing has or will come easy.
I've decided I don't want to do this.
So this is your 7th baby, huh?
Gwendolyn McCrary's 7th pregnancy is unlike any of her other ones.
So we're gonna induce you today because we think you have this abscess in your mouth here. Okay. And how long have you been having this pain?
Since Tuesday.
Since Tuesday, okay. Is it making it hard to talk a little bit? Yeah, you can see it's all swollen there.
Now 38 weeks pregnant, Gwen is suffering from an extremely painful abscessed tooth.
What we're worried about is the abscess spreading and her becoming septic, which means the bacteria is in her bloodstream. And if you're pregnant, that poses a lot more risk than it does if you're not pregnant. So the baby can get infected. Any infection in the baby can cause a poor outcome at delivery. The baby can be less likely to handle labor. We decided to induce her, and then we could treat the dental abscess more aggressively.
This contraction's getting stronger, huh? I'm gonna push on your belly a little bit.
Gwen's discomfort has been intensified by an extremely swollen belly that may be a result of an increase in amniotic fluid. Unfortunately, there's nothing her doctors can do to release that pressure.
I definitely can't break your water yet. The head's way too high still.
Tammy Lukovic is in the OR, trying to give birth to her twins.
Okay, let's go. Let's go.
One more like that.
You're almost there.
One baby is head first, the other is feet first.
There we go.
Heads out.
Heads out. Hold on. Let's get ready for the shoulders.
Doctors are hoping delivering baby A will cause baby B to flip over.
There you go, like that. Push like that, push like that, push like that. There we go, push again. Oh, look at this first one, baby boy.
Baby A is a boy.
That's definitely a boy.
The ultrasound shows that baby B isn't flipping.
Okay. Hold on. It was going to be the quickest route to delivery by getting the feet out first rather than trying to manipulate and get a baby to come around.
Although doctors knew there would be some resistance in getting baby B out feet first, they weren't expecting this.
Bear down, get you some fundal pressure.
The baby is stuck. It's been over a minute since Tammy Lukovic's second baby started to come out feet first,
Just push, just push.
only to get stuck.
Last 2 minutes just seemed like forever.
Doctors discover that baby B's arm is wrapped around his head, and he's caught up under his mother's pubic bone. They need to carefully manipulate the baby out of the narrow birth canal.
It took about 2 minutes after we had the last heart rate to get him out, get his arm untangled, kind of get the head tucked in and get him out. Two boys.
Fortunately, baby A's successful head-first delivery paved the way for his brother.
You can get that baby out quickly and relatively safely as long as the first baby was of at least the same size or larger as the second.
Tough time coming out of the birth canal. So right now, you basically are continually reassessing his ability to support his breathing.
Congratulations, they're beautiful.
He just needs a little bit more help. I want to keep a little bit of closer eye on him, okay?
How they're supposed to breathe in the beginning? Seems like he's struggling a little bit.
Maybe a little bit. That's why we're going to take him over and
Why don't
watch
you
him
take him?
real close.
Yeah. Go ahead, take him.
This would be A. He's 5 pounds 4 ounces, 17 and a half inches long. Beautiful little guy.
It's a baby brother.
Yeah.
While baby A, Matthew James, spends his first day with mom and dad, his younger brother, Justin Michael, heads to the NICU.
I feel like I pulled something, actually. Oh.
Carla Miller has been waiting 12 hours to hear these magic words.
I'm going to see if I can break your water now.
That's gonna hurt too, right?
So once the water breaks, the whole labor is gonna just kick into high gear. That's usually what happens. Breaking of the water is a real important part of the induction, so that's what we've been waiting for this morning.
Since her arrival, Carla's labor has been slow going.
Oh, I got your sock.
Oh.
That's it. Lots of water.
Oh.
Nice clear water.
Oh.
3 to 4 and 70%.
Okay. Yeah, it was good as could be expected.
She's been having contractions, but there really hasn't been any significant change in the condition of the cervix. We started at 3 centimeters, right?
Right.
And now with 3 to 4, and it's time to start seeing some progress. It's -1 station now. That's almost engaged. The head's coming down pretty well into the pelvis.
We got some contractions going this morning with Pitocin, and now she's got really regular contractions. So now breaking of the water is really going to help at this point, and it's going to make sure that she delivers the baby today.
Do your best to postpone the epidural, okay? Because sometimes if we give it early, it slows things down.
Oh, I don't want that.
Right? No, you don't want that. So if you can handle it, wait a little bit.
Okay. But when I feel like it's like,
Yeah, well, yeah, when you feel it's like that, yes.
I'll handle it for a little while then.
Okay.
All right.
Nothing comes completely free, and when we get the epidural too early, you get rid of the pain, but you lengthen the labor.
Well, the epidural's gonna hurt too, isn't it? Just doing that, the way they describe it, it's gonna sting and this and that.
Then if you're worried about how much the epidural is going to hurt, then you're not having strong enough contractions. Because when you're in good, strong labor, having the epidural put in doesn't bother you. It's not that uncomfortable.
Yolanda Harris.
How are you?
8 years ago, Yolanda Williams Harris gave birth to spontaneous twins. And now she's going to give birth to another set of twins.
How are you this morning?
Oh, fine.
How are the babies?
Pretty good.
Are they busy?
They are busy.
They are busy.
But this time it's different.
Just breathe normally.
This time, her babies fall into the high-risk category.
One of the twins is very small. It's what we call growth restricted. So that puts the baby at real risk for getting into distress and actually dying before delivery.
Yolanda is at a critical point in her pregnancy. She's made it to 36 weeks.
It's not worth the risk to wait any longer. At this point, the baby should be mature enough. So she's been scheduled for delivery in 2 days.
During her last ultrasound, Yolanda learned that twin A was breech. She's hoping that the baby has turned to a head-down position.
This is twin A, the female. She's breech. And then twin B, his head is down here.
If the first baby is breech, there's too much of a risk that as you're delivering the breech, the aftercoming head can get tangled up in parts of the second baby. You know, the chin can get caught on the chin or the head of the second baby, or could get caught on a leg, and you just then are in real trouble. You can't get the baby out.
Unless her baby flips within the next 2 days, Yolanda will have to deliver by C-section, her first.
The other births were vaginal, so that's what I'm used to. It'll be a new experience, though. Yeah.
You're to be here in labor and delivery at 1 o'clock. C-section with a tubal, right?
Yes, that's me.
Okay, that's what it is.
Okay. Bye-bye now.
Bye-bye.
No matter what, I'm delivering Wednesday. We're coming here at 1 o'clock. And come what may, yeah, babies will be arriving. C-section or vaginal, however they decide to get here, it will be Wednesday. And I'm not going past Wednesday. I am ready. I am very ready. Don't try to run away now.
We're gonna break your water because of that little bit of the deceleration in the baby's heart rate. We want to put an internal monitor on inside, okay? You know, I wonder if some of the reason the head is not coming down because she had so much fluid.
Gwen McCrary is stuck at 4 centimeters. And now her baby is beginning to show signs of stress. His heart rate is decelerating during contractions. It's a delicate situation. Doctors have to make sure that when the membranes are ruptured,
There's still another layer, multiple layers to this bag here.
the baby's cord doesn't get stuck between his head and the cervix. If it does, Gwen will have to be rushed to the OR for an emergency C-section.
That's the fluid. All right, keep your hand in there.
I'm making sure the head is well applied to the cervix, that we didn't get a cord coming through when we broke her water. I know you're really uncomfortable now. Hang in there for a few more seconds, okay? I'm gonna put the internal monitors on, okay?
After 6 kids, Dad, Raymel Easter, knows the drill.
Now the time is ticking, we'll see. Baby can come anytime you get ready. Ain't no turning back now. Ain't no going home without the baby now.
As Marla Rawson's father lies dying at the other end of this medical center, his daughter, only 31 weeks pregnant, has to deliver her baby right now, or he too might not survive.
We are going to do a C-section to get this baby out. She's got chronic hypertension. She needs to be delivered because she has had some very elevated blood pressures.
Marla's blood pressure has reached highs of 170/110. She's veering dangerously close to a stroke or seizure. The only cure? Delivery.
You're gonna feel some pressure. Yeah. It's coming. One more pull here. I've got it.
Get ready, guys.
Cord loop. Got it. There we go. Hey, baby.
1659.
The baby seemed very vigorous, very healthy, at least initially. It looks as though it's going to do very well. 30 seconds to take a peek at him. Here you go. Hi.
Hi, cord folks.
Hi, baby Nicholas.
Probably hasn't had to hear Nicholas cry. I was like, oh my God, he's crying. Can you hear him? I kept telling my husband, can you hear him? Can you hear him?
At 3 pounds, 15 ounces, Nicholas Rawson is big for his gestational age.
Heart rate's about 120, 130.
Listen to that. He's got, you know, a good set of lungs. And his color looks good.
I know, you gotta breathe, buddy.
Here we go, Mama. I'm gonna bring him out for a little bit so you can see him. Say hi, Mommy. Hi, Muffin.
That's Nicholas.
I'm gonna take him over to the NICU and we're gonna get him all settled in, okay? You wanna give him a kiss?
Okay.
All right.
But it's a bittersweet moment for Marla, because as her son is taking his first breaths, her father has taken his last.
He was just waiting to hear from my mom that the baby was born, and I think he just let go then.
It's me, Renee. I have a baby.
In the NICU, Nicholas is struggling. The steroids he was given in utero weren't enough to develop his lungs for life outside of the womb.
The baby's actually having more difficulty breathing. So we're gonna intubate the baby and put him on the ventilator.
We're gonna give him a surfactant, which is a substance that you and I have in our lungs that help keep our lungs open. And hopefully we'll have him breathing on his own by morning. They did a chest x-ray and they got a picture of his lungs, and the lungs looked worse than we anticipated at first.
Doctors are hoping that the double doses of surfactant will work so that they can take him off the ventilator. The next 3 hours are crucial. Nicholas Rawson has gone from bad to worse.
And this is the area that we were concerned about here.
His lungs are stiff and refuse to open up. Doctors have put him on 100% oxygen.
In this film, we don't see it at all. We just see
it
severe
is
RDS.
a very severe RDS, and it's a pretty significant disease.
RDS, respiratory distress syndrome, is not uncommon in premature babies, but some babies don't respond to treatment as well as others. That's when doctors get concerned.
He started grunting, and we thought he'd
And
do
he
okay.
just got worse and worse.
He got worse.
Then he got
quickly.
intubated.
Correct.
Okay. Baby is currently on the respirator. He's getting good support for oxygenation. Throughout the night, we will support what baby needs. We'll make sure the blood pressure and heart and everything else is okay, and continue to give ventilator support.
We will hope that he will turn around, but tonight's going to be pretty touch and go for the next couple hours because he was so critical when he first got here.
Are we here promptly at 1 o'clock?
I believe so. 8 minutes to spare.
All right.
In a couple of hours, Yolanda and her husband will add a second set of twins to their growing family.
This is my daughter, Robin. And these are our other twins, Brian and Bobby. This to kind of keep my focus and to help me to remain calm and reduce my anxiety.
Yolanda's last 2 pregnancies were vaginal births. But because twin A is breech, she's been scheduled for a C-section.
Anything like seizures, migraines, epilepsy?
No.
With baby B severely growth restricted, almost half the size of his sister, doctors want to deliver Yolanda right away.
Okay.
Before her C-section, another ultrasound to make sure that baby A is still breech. But now, things have changed.
Yeah, they're both breech.
Oh, are you serious?
Mm-hmm. They're like laying on top of each other. So here's A's head, and here's B's head. And there's one body here and the other body here, and they're laying on top. A is laying on top of B.
It's as if both babies are coming in the world telling everybody to kiss their ass. So we knew the one already had that attitude, and now it appears as if they both have taken on the attitude of, yeah. So I have to have a C-section. That's the only way to go now.
You're doing great, honey. Just breathe.
Just breathe does not work. Ow.
Carla Miller's day has been a series of cervical checks and blood tests.
We just checked Carla's sugar one more time. 86, just on the mark. Just what we want. Perfect.
I'm just too old for this. My body can't handle it.
You're gonna be fine.
Finally, she hits a critical point in her labor.
Carla is up to 5 centimeters. I think she's halfway done, so we should expect more rapid changes at this point. I don't think it's gonna take all day now.
It's a good sign, especially for a mother with gestational diabetes.
Diabetic mother could have a quite large baby who would have then problem being born because of its size.
Carla was induced today at 37 weeks for that very reason, so her baby wouldn't get larger.
Worst case scenario for big baby is that it will stop coming down. It won't come down any lower, and then the doctor will have to do a C-section.
The other problem is these big babies in particular are at risk for stillbirth. They're at risk for dying before delivery.
2 hours later, Carla's baby starts showing signs of stress.
Baby's heart rate's having some decelerations. From the looks of it, they look like the kind of decelerations we see when there's some pressure on the cord. So here's where we see the baby's heart rate dropping with a contraction. Here's another one that's typical.
To take pressure off the cord, Carla's doctor stops her Pitocin, the medication used to induce labor, but that in itself can cause problems.
Our goal here is to get this baby delivered. If she doesn't get Pitocin, she doesn't have contractions. If she doesn't have contractions, the baby is not going to get delivered. Now, if the baby can't tolerate labor, the baby has to be delivered by cesarean. But the only way we'll know if the baby can't tolerate labor is by producing labor.
With a portrait of her 3 other children to focus on, Yolanda prepares for her first C-section.
Okay, we're opening up peritoneal cavity now.
A few hours ago, she learned that not one, but both of her babies were breech.
Tissue forceps smooth ×2.
A C-section was the only option.
Rotate the other way.
At 4:11 p.m., Cameron makes her debut.
Here's the first one. Here she is.
She's big for 36 weeks, 5 pounds, 12 ounces.
Here's the little boy.
A minute later, she's joined by her brother Kyle,
Here he is.
who at 3 pounds, 11 ounces, is almost half her size.
Oh, they're going to get this.
He's having a little difficulty breathing. He's pink, his color's good, and he's fairly active. But he has small heart murmur, and he's just too small to stay in the well baby nursery, so he'll come to intensive care. You have to take a trip to the children's hospital, huh?
In and say hello to your son. He's going over to the neonatal intensive care area. He's fine right now, okay? Congratulations to the both of you. All right? Questions before we go?
No. 80 on rest and 36 to rectal.
Surprisingly, Kyle's newborn evaluation scores are higher than Cameron's.
And he's a whole lot smaller than his sister. But his APGARs were better than hers.
Kyle is breathing on his own. Meanwhile, his sister needs help.
You would have expected the male twin to be more prone to respiratory distress, but Mother Nature has other ideas, other days, and all we can do is react to them.
But soon, these twins will change position once again.
This is a warmer, so that way we're putting in nice warm fluid.
With each deceleration, doctors are getting worried that Carla Miller's baby is stressed, possibly leaning against her cord. So they decide to add liquid back into the uterus.
Just normal saline, kind of like amniotic fluid. The baby doesn't have as much cushion, so we're trying to add a little more cushion.
The baby starts to respond to the procedure.
We have some pretty deep decelerations, but we also have nice accelerations. Accelerations are a reassuring sign. The good signs trump the worrisome signs. I'm just going to do an exam. I'm going to see if this cervix is yielding. Yep, it's time to have a baby. Okay, what do you think about that? It appears the baby's okay. She's made a little bit of progress in the dilatation of the cervix. Not quite as much as we would like, ideally, but there is some progress, and so we'll continue to wait and continue the induction of labor.
Take a look here. This is just like what we're going to use instead of a speculum, okay? So we'll just be a little bit of pressure.
But to ensure that the baby is still getting enough oxygen, the doctor orders a pH test.
We're going to put something into the vagina that allows us to see the top of the baby's scalp. And we'll collect a few drops of blood from the baby's scalp. We nick it, sort of like taking blood from your fingertip for the blood sugar. If the pH is in the normal range, it means the baby is not in distress. Maybe it means that the baby is not being harmed by these episodes of compression of the cord. If the pH is low, then that means that the baby is getting into trouble and we have to deliver the baby right away.
A normal pH level is 7.2. Any lower, and Carla will have to be prepped for an emergency C-section.
The 7.32 means that the baby's not in trouble right now. The baby's got plenty of oxygen. Anything below 7.20, we'd take the baby to the operating room. So we've got time to let her try to deliver vaginally.
Head's coming down, that's why you're feeling pressure, and... Oh, wow. How does 9 sound? Will you take that?
Oh, yeah.
Okay. Excellent. Oh. And station, +1.
Yay. Oh, yes.
Oh, yes.
Finally, some good news.
You see, not only is the cervix dilating, but the head's coming down.
Oh.
After suffering from gestational diabetes and carpal tunnel nerve damage, discovering she was a cystic fibrosis carrier facing a hysterectomy, Carla Miller is ready for some good news.
I'm so happy. I couldn't be happier. Well, I could be, but she could be in my arms, so then I'd be really freaking happier. So, oh.
Carla is ready to deliver. Doctors are concerned that because of her gestational diabetes, Carla's baby might be large.
Push right where my fingers are. You can hold it all down. Hold your breath. Oh, I see hair. That's it. That's the way. Keep going. Contraction. Ready? Curl around. Big deep breath. And push down into your bottom. Come on as hard as you can. Hold your breath. Hold your breath.
Once the baby's head emerges, doctors can see the reason for the baby's heart decelerations. The cord is wrapped around her neck.
Keep pushing. That's it. That's it.
Curl around and push all down into your bottom. Come on, push her out. Push her out. Keep going. Keep going.
Yeah. Oh, you can rest her foot there. Good job. 2101, 901.
Doing very nicely. Just stimulating her a bit to get her to breathe and cry vigorously.
Haley Marie Miller weighs 5 pounds, 12 ounces, a perfect size for baby and mother.
Of course, the baby was even smaller than we expected, which was nice. That made it all good. We're always ready for shoulder dystocia when we have an infant of a diabetic. That didn't happen in this case.
Congratulations. Oh, her face is a little purple. That's just because she's bruised a little bit.
Carla's long struggle to create and carry this miracle baby finally has a happy ending.
Hi, baby girl. Oh.
Nicholas Rawson is 26 hours old, but it's been a difficult 26 hours.
Obviously, the surfactant didn't really do all that it was supposed to do like we originally thought. He is getting better, but he went on another type of ventilator, which is the Oscillator.
The Oscillator is a high-frequency ventilator. It gives Nicholas more breaths per second.
I'm not really 100% sure how long he'll be on the Oscillator. It's all up to him. He's calling the shots. We just have to figure out what he's saying to us.
When we're checking the blood gases, we look at carbon dioxide and also the oxygen level to determine if we can actually manipulate the vent to turn down the ventilator. And we were very happy with some of those numbers this morning, and so it looks like he may be turning the corner for us this morning.
Overnight, doctors were able to wean him from 100% oxygen support to 55%. At 30%, he'll be able to breathe on his own.
Maybe Rawson.
Right here.
He's better than I expected him to look. He's way better than I expected him to look. So.
Tomorrow, Marla Rawson has to go home without baby Nicholas. It's a double blow.
That was the worst part of that. My father dying in the middle of all this, like totally unexpectedly. I was sure he was going to get to see the baby. He didn't. So I guess that was the worst part of that.
On the day Nicholas was born, his grandfather died. And now Marla must mourn the loss of one loved one and pray for the survival of another. It's been 2 days since Yolanda delivered her second set of twins. Today, she finally gets to meet them.
It'll be nice to see them. See who was kicking and pulling and stretching me for these past 8 months or so. So yeah, I can't wait.
Grace, what is his name?
Hey there, little man. For you.
Kyle was the smaller of the twins.
He's adorable. And he is. They had nicknamed him Peanut when he was inside of me, and I see why now, because you are.
But he's doing remarkably well.
Had 2 cc's of formula and evidently did very well with that feeding. Gobbled it right up, which makes me extremely happy because there was some concern that maybe he wouldn't catch on to the whole feeding thing very quickly. But I'm glad he's a little piglet because we need to puff him up.
His sister Cameron is also doing better.
Well, this is Cameron Lake Harris. She was 5 pounds, 12 ounces, 18 inches long. Had a little breathing trouble, but she's doing much, much better today. No tubes, no nothing. And she's doing real good.
But the first 72 hours of life are a roller coaster, and a seemingly healthy baby can succumb to a number of things without warning. It's been 9 hours since Gwen McCrary started laboring, and she's getting restless.
Now listen to me. I want you to save all of your energy to push, okay? Don't waste any of your energy getting upset about this. Go ahead and bend your knees up for me, okay?
A couple of hours ago, Gwen's baby's heart rate showed signs of stress, so doctors stopped her Pitocin. But now she needs those contractions to get this baby delivered.
She's still 8. And -1. Did Amory want to restart the Pitocin?
Doctors are hoping she'll get to 10 centimeters quickly without causing too much stress on the baby. But her abscessed tooth is creating another set of problems.
So the baby's heartbeat's getting a little fast, okay? That could be a sign that you're getting infected.
Gwen's temperature is rising. If she's getting infected, so is her baby. She needs to deliver now. For the past 6 hours, Gwen's baby's heart rate has been all over the charts.
Baby's having some heart rate decelerations, meaning the heart rate is dropping. So we don't really have a lot of time to wait. Either she has to deliver now or we need a C-section.
In a minute, we'll get the team together and the baby will dive into the world. I'm hanging.
I reduced the cervix behind the head and now she has to push. She should be an excellent pusher since it's her 7th baby, I think, so.
Okay. Let's push. Put your hands behind your knees and push. Push where my fingers are. Push, go. Push. Push. Keep it going. Okay, good. Deep breath, one more. All right.
Raekwon Jamal is a big boy.
8 pounds, 14.5 ounces. Almost 9. He's huge. Woo! And he's got a big old 37.5 centimeter head. That's big. I hope you didn't buy too many newborn diapers because he's not going to be wearing those. He's going to go right into size 1. Oh, here we go. So he's going, oh, how did I end up here? What's going on?
Right now, Gwen, who was suffering so much physical discomfort during the past few days, is feeling no pain at all.
Well, my tooth don't hurt no more. I feel better.
Perhaps it's the anesthesia, or maybe all that pain has turned to joy as she cuddles her special delivery. Yesterday, Justin Michael Lukovic was born feet first. The process took a lot out of him, so he was rushed to the NICU.
He had no tone, his color was poor, he had minimal respiratory effort. You know, those types of things tell us that he was not responding well to the delivery. We started seeing improvement on him within about 2 hours after delivery. He really started to perk up, his respiratory rate started to slow down, he was seen more responsive and definitely more alert than he had been at delivery.
The only evidence of a traumatic birth? Bruising on his feet and calves.
Oh, and it will clear up. That's the nice thing, is the bruising will clear up within a couple days and there will be no residual from the bruising at all.
Today, Justin graduates from the NICU and gets to join his brother Matthew for the first time.
The consensus is we think they look alike, huh?
They look alike.
I think so.
Look at this head of hair.
Well, he got the hair
but they look alike.
Today is actually a very special day for Matthew. He's the 200th baby born on the Special Delivery series. It's a huge photo op, and he's sharing the momentous occasion with baby number 201, his brother Justin. But for Mom, Matthew and Justin are both equally special deliveries.
I'm just very tired, but I feel great. I feel wonderful. What a blessing.
We are about to go over to Rainbow 4 and go pick up our little girl Cameron and visit with our son Kyle, and I guess start this new journey.
Today is homecoming for Cameron Harris, but brother Kyle is staying because since birth he's already lost an ounce. And in a 3-pound, 11-ounce baby, that's a significant amount.
He still is under 2 kilo weight, and so he has to gain more weight to go home.
The baby is also jaundiced. His liver isn't breaking down the extra red blood cells that his prematurity produced. He's spending the next 24 hours under phototherapy, but doctors aren't too concerned.
The prognosis is excellent. He will probably end up larger than his sister and will be beating her up in due course. And by the time they're teens, I think he'll have the upper hand, at least physically.
I'm really happy the fact that, you know, we can bring Cameron home, but then it's as if we're leaving a part of the family, you know, behind. But I know where the hospital is located, and I will be back. Then I'll probably bring her occasionally so she can visit with her brother.
Been the longest 9 days of your life, but hang in there. We haven't lost a parent yet.
I don't know. Heading that way.
Born 2 months prematurely, Nicholas Rawson's life has been a struggle from the start. 4 days ago, he took another turn for the worse.
He's been treated with antibiotics for over 4 days, and he does not appear to be responding. His x-ray looks like a snowstorm. You can barely see the heart borders. The lung disease is that severe. So he's a sick little boy, and his mother is rightfully concerned.
They think he had that he did have a leak in his brain, but hopefully it's very minor at this point, so.
For Marla, the past 2 weeks have been full of sorrow.
This whole process has been just too much to handle. I mean, from my father dying on the same day as the baby being born, and then Nicholas not doing well, and, you know, being on the ventilator for 9 days, and it's just, it's going on, and like, it doesn't seem that there's any good news ever. I'm hoping maybe tomorrow we'll have some kind of good news.
But right now, there is no news. And all Marla can do is hope and pray for her special delivery.
No one can give his mother assurances that all will be well. He is the sickest baby in the intensive care unit today.